you would have to just maybe choose one thing for patients to keep in mind when visiting the doctor or deciding whether or not to go to the doctors, what would it be? So what would be the one advice? I know that in the book you talk about 3 questions that you should have in mind, so maybe we can mention those.
Exactly. And that can be like a happy note to end on. So I call it ask about what matters, and you have to practice. You've got to practice this. It's very simple. The first question is, for everything you're offered, what are the risks? Right? So you have to start with the risks. Why? Because that's really important, and we oftentimes don't want to think about it, but it's there, and we need to know what the risks are. So that's the first thing. The second thing is, what are the benefits? Right? Because that's obvious. And the third thing is, what are the alternatives? And the reason for that is, and you mentioned culture before, is that we're used to respecting our doctors, which is great. We're used to trusting our doctors, which is great, but it is our body. And if there are alternatives to, say, anesthesia, if it's full anesthesia or just anesthesia for the area, if it's like a knee surgery, I want to know that. What's the alternative? You're telling me I need full anesthesia. Is there an alternative? You're telling me I need surgery. Is there an alternative? Maybe physical therapy is an alternative. Maybe something else is an alternative. So risks, benefits, alternatives, these are great questions, and you need to practice them, because we tend to be so overwhelmed when we sit in front of the doctor. We're like, okay. And then we go home and our partner says, but what are the risks? And say, I don't know. I didn't ask. Is there an alternative? Oh my God, I didn't want to insult the doctor. Don't worry. Don't worry so much about the doctor's emotions. Don't insult the doctor, but consult the doctor. Really use their knowledge, use their experience, because otherwise you're going to come home, your partner will ask, you won't have an answer, and you'll Google, and who knows what you're going to find.